I'm Dr. Tamaghna Ghosh from Uddamgaon, and I am a general physician practicing also diabetes. I am attached with 2-3 nursing homes like Fairwealth nursing homes and Vivek Eurocare, Vivacity hospitals, etc. So today our discussion about the essential of fasting for people with acid reflux. It's structured for clarity and flow, includes medical facts, practical tips, and lifestyle guidance. Today we'll be discussing an important health topic. So my goal is today to help you understand how to fast safely and effectively without worsening acid reflux symptoms. Understanding the acid reflux. What is acid reflux actually? Let us begin the understanding. Acid reflux happens when stomach acid flows back into the esophagus, the tube connecting your mouth and stomach, and this backflow can causes heartburn. The common triggers include there is spicy and fatty foods, citrus foods, caffeine, alcohol, overeating, lying down after the meals, and fasting can potentially depending on how it's practiced. So how fasting affects acid reflux actually? Positive effects of fasting is the reduced overall food intake may decrease acid production. The longer breaks between meals give you stomach time to settle, and weight loss from fasting may reduce pressure on the stomach, helping reflux. And the risks during the fasting, what is that? That is going too long without food can cause acid buildup. Overeating at iftar or after long fasting can trigger the reflux. Eating spicy or greasy or acidic foods when breaking the fast worsen symptoms. So it is not fasting itself that is the problem. It is the how we fast and what we eat actually. So essentials for safe fasting and acid reflux. Here are some practical tips to manage fasting safely. So number one, that is start your fast with a gentle non-acidic meal and choose your foods that are rich in fiber and protein like oats, bananas, eggs, whole grains, yogurt, etc. And you should have to avoid coffee, citrus, and fried foods also. And number two is don't skip the pre-fast meal. An empty stomach for too long increase acid buildup. Suhoor helps buffer stomach acid and gives you energy. And number three is break your fast gently. That is after iftar or before prolonged fasting. Start with water and a few dates of bananas. Avoid citrus juices. Wait 10 to 15 minutes before eating a larger meal to allow your system to adjust, and eat slowly and avoid overeating. Large meal trigger the reflux disease. Choose reflux friendly foods, that is lean proteins, chicken, fish, whole grains, brown rice, oats, etc. Vegetables like broccoli, green beans, carrots, etc. Herbal teas like chamomile or ginger after the meals, but not peppermint, which can worsen the reflux. And avoid trigger foods and drinks, spicy foods, caffeine, carbonated drinks, chocolate, tomatoes, garlics, and onions. Avoid smoking and alcohol completely. And you should not lie down after the eating. Wait at least 2 to 3 hours before lying down or sleeping. Elevate your head during the sleep, which can reduce your reflux at night. And last, you have to stay hydrated. Sips of water throughout the non-fasting hours. Avoid drinking large amount during meals, and consider medications. What medications that you should have to talk to your doctor about adjusting your acid reflux medication during fastings. PPI and antacid may be timed around fasting hours for best effects. And when to stop or modify fasting. Fasting may not be advisable if you have severe or uncontrolled GERD, esophageal ulcers, or Barrett esophagus, or you may have, if you have hiatus hernia, duodenal ulcers, etc. Recent gastrointestinal surgery. And lastly, listen to your body. If symptoms become severe like painful swallowing, frequent vomiting, chest pain, should stop fasting and seek medical advice and consult your doctor. To summarize, fasting with acid reflux is if possible, but it requires thoughtful planning. Eat mindful, avoid trigger foods, hydrated well, and seek medical advice when needed. Fasting can be a source of spiritual and physical renewal when done wisely. Thank you for your attention. I hope this session will empower you and your patient to fast more comfortably and safe. Thank you.